Tapos every time nag-lecture ako nito, nagagamit ko talaga siya kasi ang dami ko namang patient in shock. Parang nare-review din ako. So, wait lang, sarap ko muna kayo. Circulatory shock and physiology of its treatment. So shock is defined as inadequate tissue perfusion with a relatively or absolutely inadequate cardiac output. Uniform, as long as there is inadequate tissue perfusion. But sometimes, hindi lang siya inadequate cardiac output kasi may shock naman na adequate yung cardiac output, pero it's just that the delivery is affected to the point that there is poor tissue perfusion. Kaya kailangan siguro i-update yung dami kong reklamo, no? So cardiac output may be inadequate because, one, hypovolume shock. So ibig sabihin, nabawasan yung volume of blood inside the vessel. Or it can be distributive or vasogenic or low resistance shock. Ito yung best example is like sepsis, kung vasodilatation of almost all arterioles, resulting into hypotension. Normal, I mean, enough yung liters pa rin yung volume inside the vessel, kaso lang nag-dilate kaya bumaba yung BP. And cardiogenic shock, this time, normal naman yung amount of volume, 5 liters pa rin, but it's just that the muscle, the myocardium, is not pumping well. This is very common. Sa lahat sa kanila, ito yung mas common in cardiogenic shock. And shock. Normal yung volume of blood, 5 liters pa rin, kaya lang di na makapasok. For example, the best prototype, the best example here is if there's a large thrombus in the main pulmonary artery, so pulmonary embolism. Kaya kahit 5 liters yung dugo mo in the vessel, pag hindi naman siya makapasok to the main pulmonary artery, ganun din, bababa yung cardiac output. So, these are the 4 main types of shock. So, in order to understand shock, kailangan nyo maintindihan yung graph na to. Ito yung amount of volume removed, and we look at what will happen to the cardiac output, arterial pressure. So both, whenever there is a drop of blood volume, there's also a drop of both the arterial pressure and the cardiac output. So if we compare the two, there is marks, parang mas grabe yung pag-drop ng cardiac output as compared to arterial pressure. That is because meron ka muna ditong nami-maintain mo na yung blood pressure because of sympathetic activity, because of yung mga mechanisms to maintain a BP na diniscuss natin. Yung baroreceptor, chemoreceptor, and ischemic response. So, dito, yung baroreceptor muna at saka chemoreceptor, kaya nami-maintain yung arterial pressure at saka sympathetic activity. So, this mechanisms is geared towards maintaining BP rather than maintaining cardiac output. So, we should ask, mas uunahin i-maintain ang BP kesa i-maintain ang cardiac output. Kasi yung mga baroreceptors, yung main goal nila is to maintain the BP. Kunwari, nabawasan ka ng dugo, there are mechanisms to keep the BP at least beyond 60 millimeters mercury. Okay? More than maintaining the cardiac output. The primary goal is to maintain the BP. Pag below 50 na yung BP, meron yun, tumataas pa yung arterial pressure kasi nga yung CNS ischemic response, hindi siya nagpo-function, hindi siya na-activate hanggat hindi below 50 millimeters mercury yung BP. So, yung gap dito, yung a little bit increase of arterial pressure is because of the last ditch stand or the CNS ischemic response. So we should ask why. Why is it that the baroreceptor, chemoreceptor, and all these mechanisms maintains, if the purpose is to maintain arterial pressure more than maintaining the cardiac output? It's because of this study. Siguro ganyan. So, merong mga dog, kawawa naman yung dog, no? Pinag-experiment nila. So, in anesthesia, and then, kinuna ng dugo, So they found out that dogs 1, 2, and 3, the blood pressure didn't go beyond 50 millimeters mercury. All these 3 dogs survived, but those animals na yung BP immediately dropped below 50 millimeters mercury, all of them died eventually. If the systolic BP or the mean arterial pressure is less than 50 millimeters mercury, the drop of BP has effect to further decline the BP. Parang shock itself causes still more shock. And that's why I think the body is trying to keep arterial BP above 60 millimeters mercury para man lang mabuhay ka, more than trying to maintain the cardiac output. Okay. So, there are 3 stages of shock. The first is the compensated shock. Ito yung bumaba yung blood volume or yung blood pressure, but the mechanisms are activated to keep the BP up. Yan yung compensated stage. Then we have progressive stage. Ito naman yung the body tried to compensate, but eventually it was not enough. It was inadequate. That's progressive stage. So it would result to muscle weakness, hypothermia, mental changes, or renal ischemia and failure. Ito na yung nagkakaroon na ng wala ng ihi. Okay. So the last stage is irreversible shock or refractory shock. Ito yung kahit anong gawin mo, mamamatay na talaga yung patient. So somehow, if I see this among my patients, I start prognosticating the patients. Kasi kahit anong gawin mo, wala ka nang magagawa to reverse. And that's why, if you detect, if you become a doctor, nandito ka pa lang sa compensated stage, you should do everything to reverse the shock. Kasi pag nandito ka na sa progressive stage, medyo mahihirapan ka na, lalo na sa refractory shock, patients will die. Okay, kaya pag yung na-admit yung patient na, Doc, palpatory 50, talagang nangangarag yung duty ko. Gusto ko talagang gawin lahat to BP up. Lahat-lahat na pinagsasabay-sabay ko na. So kung mapapansin nyo, yung style ko is start agad ng DOPA, start agad ng NOR-epi, and then hydrate kung hindi congested yung pasyente. Yung ibang doctor kasi, they'll just try to start with DOPA, increase it until maximum. Pag hindi pa rin, they go with norepinephrine, parang ganon. Ako hindi. Start agad dalawa. Eh di kung tumaas yung BP at saka mag-tachycardia, di close ko na lang. Parang ganon. And ito yung, if you try to use this knowledge, yan yung reason ko bakit aggressive ako agad. Because I don't want the patient to go into a progressive stage or irreversible stage. Alright. The non-progressive stage, alam na natin to, baroreceptor or CNS ischemic response. There's activation of the RAA system and activation of the vasopressin to keep the volume up, and the local conservation, translocation of fluid reserve. Ito yung, di ba, sa veins, venous capacitance niya. You try to vasoconstrict the veins para mag-add ng increased venous return to somehow increase the cardiac output and the BP. And then we stimulate the thirst and drinking mechanism para uminom ka. Yung progressive stage naman can either be, ito yung mga nangyayari, yung there will be cardiac depression. Pag mababa kasi yung BP, the coronary artery will be less perfused. And eventually, the myocardium will have infarction or ischemia. It would add to all the problem. Kasi for example, yung initial problem lang is buno niya, and then there is bleeding, and then hypovolemia, so nag-hypovolemic shock, kahit wala pa siyang myocardial ischemia or infarction. But if you do not reverse that, magkakaroon siya ng ischemia because of a decreased coronary perfusion. Yan yung progressive stage. And then vasomotor failure, ito yung sobrang bumaba yung BP, hindi mo na-reverse, and then there is brain hypoxia. And that will be a problem. We call that hypoxemic ischemic encephalopathy grounds. And ito yung mga pasyente na nag-cardiac arrest, tapos na CPR, na delay, tapos CPR pa rin, tapos na-revive yung pasyente. eventually yung patient, ano pa rin, comatose, GCS4, GCS5 because of hypoxemic ischemic encephalopathy. So itong tinatawag na blockage of very small vessels, kasi if the if there is decreased blood volume or decreased blood pressure, there is a stasis of flow on smaller arteries. And so the blood there will kasi ng mga production of whatever agglutination to the point that the blood nagkakaroon sila ng sludge formation or blood clots. And there are increased capillary permeability. Ito yung pag sobrang tagal na ng hindi mo na reverse agad, nagsisip out yung fluid or plasma into the interstitial space and mababawasan ka pa ng dugo. Kaya ngayong iba, di ba, nagkakaroon ng edema. Sobrang tagal sila sa ICU. Mapapansin niyo yan. They're on both inotropes, norepinephrine, dopamine, tapos bagsak pa rin ang BP. 80 lang siya for 3 days. Mapapansin mo yan, mamamaga na yan buong katawan after how many days. That's because of an increased capillary permeability. Kasi di ba, anyway, so release of toxins, release of histamine, serotonin, enzymes, tapos yung endotoxin, nakakakos kasi siya ng vasodilatation. And then yung endotoxin din has a direct effect to the myocardium, causing ischemia. Yung metabolic acidosis is also not good because nagkakaroon ka pa ng vasodilation, tapos pangit na derange na yung hemodynamics mo. And on molecular level, there is cellular deterioration like decreased ATP production, decreased sodium-potassium pump activity. Alam naman natin na yung sodium-potassium pump, dapat ilalabas yung sodium, ipapasok yung potassium, pero dito, nasa loob yung sodium, so yung cell nagsiswell. Ayun, eventually edema, tapos meron pang decreased mitochondrial activity, decreased nutrient utilization, and then rupture of lysosomes, tapos autolysis, and then eventually mamamatay yung pasyente. Okay. So there is that positive feedback. Ibig sabihin, bumaba yung cardiac output, and then mas ibababa pa yung cardiac output. So this happens if the blood pressure is, let's say the mean arterial pressure is below 60. Delikado siya kasi because the shock will eventually cause another shock. Kaya minsan, kahit hypovolemic shock lang siya, nadadagdagan na siya, nagiging cardiogenic shock din. Kaya hindi lang siya isang shock. Sometimes nagiging multiple cause of shock because of this positive feedback. So decreased cardiac output, decreased BP, results into decreased perfusion to the myocardium, decreased perfusion to all the tissues, and then there will be venous pooling, decreased blood volume, cardiac depression. There will be cardiac depression, there will be myocardial ischemia, less pumping, mas aggravate yung decreased cardiac output. And then if the myocardium is not pumping well, siyempre there will be blood pooling, meaning to say the end diastolic volume and systolic volume, increases, the pressure in the LV increases, the pressure in the LA decreases, lahat na yan, magkocongest na yung pasyente. Tapos minsan, there is decreased venous return, kaya pa na nakapadagdag sa decreased cardiac output. Alam natin yon, dapat the venous return should equal the cardiac output. If there is a decrease in venous return, there is also a decrease in cardiac output. Okay, hypovolemic shock, madali lang to kasi nakikita nyo yan hemorrhage, trauma. Meron kasi yung hemorrhage, internal hemorrhage. Walang lumalabas na dugo sa skin pero nasa loob pala. So still hypovolemic shock. Surgery, burns is another cause of hypovolemic shock. Kasi yung skin, doon natin mapapansin na importante pala yung skin to keep the fluid inside the body. Kasi kung nagbaburns, di ba, mahirap nagkakaroon sila ng hypovolemic. Aside sa mahirap i-BP dahil sa burns, pero they have decreased blood volume. And diarrhea, vomiting, can result also to hypovolemic shock pag sobrang dami na. Yung distributive shock, anaphylaxis is an example because sa anaphylaxis, diba, there are release of histamine that causes peripheral vasodilatation, and yun, makakakos na ng shock. Sepsis, paulit-ulit to, the physiology is just peripheral vasodilation because of production of all toxins. So because of vasodilation, it will cause distributive shock. So fainting, yung neurogenic shock, is another cause of distributive shock. Okay. Cardiogenic shock, pag kunwari nag-MI yung pasyente, kaya pangit yung contractility ng myocardium, so the stroke volume is decreased, the cardiac output is decreased. Arrhythmia, ganun din, because of irregular heartbeat, there is no effective ability to squeeze the blood out, decreasing stroke volume, decreasing cardiac output. Ganun din sa congestive heart failure because of increase in pressures in the LV. So, naapektuhan yung hemodynamics. Kaya yung forward flow naapektuhan din. So, it can cause cardiogenic shock. Obstructive shock, yung pulmonary embolism ang best example. But another example here is cardiac tamponade. Ito yung there is a lot of fluid outside the pericardium. Kasi alam yung nangyayari is, for the left ventricle or right ventricle to expand, it must overcome the pressure outside. That is the pericardial pressure. So if the pericardial pressure is higher than the intracardiac pressure, then the RV or the LV cannot expand. So ganun ang nangyayari sa if there's a large, very large pericardial effusion, the pericardial pressure is higher than the intracardiac pressure, kaya hindi maka-expand si RV and LV. So that's what we call as cardiac tamponade. Tension pneumothorax, ayun, di ba sa lungs, dapat negative pressure yan. So if there is seepage of air into the lungs, magkukulapse yung lungs, and then, ayun, kawawa ka, mamamatay yung pasyente. That's obstructive shock. Okay. So, kahit 10% lang pala, kahit 10% ang mawala na blood volume, hindi ka pa naman magiging progressive shock. Kayang-kaya pa yan ng katawan mo to compensate pag 10% pa lang. But if the blood loss is beyond 10%, good luck. Kasi pag below 10% pa lang yung blood loss, alam mo yun, sympathetic activity, increased total peripheral resistance, kaya tataas yung BP, and then increase contractility, kaya may improve yung stroke volume, may improve yung cardiac output. So, ganun lang siya. Increasing venous tone, increasing venous return, somehow can improve the cardiac output. So, kung hindi ma-improve yung venous return, bababa din eventually si cardiac output. But luckily, there is concomitant venous, increase in venous tone, increase in venous return, na maintain ang cardiac output. Okay. Plasma loss. Ito yung good example are burns or intestinal obstruction, diarrhea, excessive sweating, hypovolemic. So, septic shock, madadiagnose mo naman yun kasi there are signs of infection. Let's say, may fever, or merong rashes, or may coughing. Makukuha mo yan sa history kung septic shock talaga yung patient. Sabihin ng pasyente, ubo siya ng ubo, tapos yellow yung phlegm, or nagkoreano yung pag-ihi, meaning dysuria, hematuria, mga ganun ba? There is something in the history and physical exam that will help you if this is a septic shock. So if you get the BP, minsan, let's say, kung swerte ka, kung may nakuha ka pang BP, for example, if there's a wide pulse pressure, it could help you na baka septic shock yung patient. High fever is a very good indication to say that this is septic shock. So, the treatment usually is you have to do Trendelenburg. As a nurse, ito yung ginagawa niyo. So, itataas yung paa para man lang yung blood volume na tinatago ng veins in the lower extremity, maidagdag lang sa venous return. Or we can transfuse blood if there is blood loss, or we can just give hydration through plasma or dextran. And then we can give oral ORS, orisol, parang ganun. But of course, pag hindi naman hypovolemic shock, for example, the cause is a neurogenic shock, such as yung magandang example din dito yung pag yung pasyente nag-anaphylactic shock, di ba, it produces histamine that causes peripheral vasodilation. Magbibigay ka ng epinephrine because epinephrine is a vasoconstrictor. Kaya ayan, life-saving siya. So kailangan aalamin mo yung cause of shock para you direct the problem. For example, if it's a hypovolemic shock, edi you transfuse blood or you give hydration with a plain LR or plain NSS, whatever Voluven, you can give that pag blood loss. Pag naman, let's say sepsis, mas maganda pag sepsis. Kasi normal naman ang volume nun nag-peripheral vasodilation lang, kaya hydration should not be the first treatment. The treatment is to give norepinephrine, which is a vasoconstrictor. Kasi ang pathophysiology ng sepsis is the dilatation of artery. Pero let's say ang cause ng hypovolemic shock is diarrhea, edi you know that hydration yon, orisol or IV fluids. Pag ang cause naman is arrhythmia, let's say nag-ventricular fibrillation, edi you defibrillate the patient and then you do CPR, parang ganon. Or you give medications like amiodarone, pag detox siya. So kung anong arrhythmia, you just treat the patient. Kaso lang hindi nyo pa level yan Kasi hindi pa kayo nag-ACLS yung Advanced Cardiac Life Support. But suffice to know that whatever is the cause of the shock, yun yung iti-treat nyo. There is that study about glucocorticoids kasi pag shock na inyong patient, minsan there is a form of shock caused by adrenal insufficiency, which means that there is decreased production of steroids. So pag bigay mo ng steroid, let's say 100 milligrams or 200 milligrams IV bolus, tumataas yung BP. So this is also helpful. Yes! Ang short lang! Oh my